Okay, sir. ठीक. All right. Hi, everyone. I welcome back to Homeo Mission 2026, Episode 2, in collaboration between Homeopathy 360 and Mission Homeopathy by Aditya Homeopathic Hospital and Healing Center, Pune. And I am Dr. Mansi, proudly on the behalf of Vision Publishers, welcome you all. In the another insightful session, we are going to have tonight with one and only Dr. Sainath Chinta sir on the very interesting topic that is case of sick sinus syndrome. I hope most of us has not heard this syndrome, and we are going to learn this syndrome by one and only our today's speaker, Dr. Sainath Chinta. Now, let me introduce our today's speaker. Dr. Sainath sir is a distinguished classical homeopathic practitioner based in Ahmednagar, Maharashtra, with over 2 decades of clinical, academic, and teaching experience. Practicing since 2003, he has been closely associated with the renowned Dr. Amar Singh Ji Nikam sir, drawing inspirational and guidance from one of the leading figures in classical homeopathy. Dr. Chinta serves as a lecturer and postgraduate guide at Kaka Sahib Masake Homeopathic Medical College, Ahmednagar, and has conducted numerous seminars and workshops for students and practitioners across India. His contributions during the COVID-19 pandemic, including distribution of free preventive homeopathic medicines, earned him recognition as COVID Warrior in 2021. A BHMS and MD Organon graduate, Dr. Chinta is widely respected for his dedication to classical homeopathy, education, and community healthcare. Now, it's time to hand over the mic to our very talented speaker, that is Dr. Sainath Chinta sir.
So, hi everyone, and a very good evening. Very nice evening here.
Yes.
Outside there is a raining. After a long waiting period, the atmosphere become cool. Everyone is eagerly waiting for the rain, and there is also a rain of homeopathic knowledge from Mission Homeopathy under the guidance of Dr. Nikam sir. So thank you, Dr. Mansi, for inviting me and inviting my all team who are working under the guidance of our beloved and great legendary guru, that is Dr. Amar Singh Dattatreya Nikam. And I hope that everyone will definitely get some important hints, knowledge, learning tips from every lecture or from every webinar of my side or our side. All team members are practicing very nicely at their place all over Maharashtra. In fact, all over India, sir, students are practicing classically. So it is a very good thing that with the collaboration with the Homeo 360, we have started this Mission Homeopathy webinar series. And today's my topic is again listening this word sick sinus syndrome. It is very difficult to get that whether it is related with nose or sinus or any respiratory system, because it is very rare disorder, or you can say there is another name for this disease. From that name, if I told that name, now everyone get that it is related with which part of the body. It is called SA node syndrome. SA node syndrome means that is related with the heart. So very challenging case it was, and as I told, we are blessed with the sir or sir's knowledge, that we are just putting our eyes closely on the case, and sir had taught us very much important things while you are in the clinic, while you are in the cabin, while you are in front of your patient, just dedicatedly work for the betterment of your patient. And when you are tuned with your patient, when you are dedicatedly work on your case, then you will definitely uh, getting some clues. See, homeopathy teaches us many things, that no case, no any case, no every case is very easy to treat. If there is a case of hair fall or pigmentation or pimples or any allergies, you have to treat with homeopathy, with single medicine, classical homeopathic medicines. Then you have to take the case, whole history, and properly case taking and analysis after that case taking for totality making. And with evaluation, proper evaluation, you have to select the medicine on the basis of perfect repetition. So we will learn in today's case, not case taking, but after case taking, some part I will want to tell you from this case. So definitely today's purpose of my lecture is to give some hints from my practice. I am practicing since 23 years, and I am always attached with sir. Till COVID, we are working with sir, but after COVID, some our activities get less, and after many days, these activities started. Before this, we are working with sir at Aditya Homeopathic Hospital for many practitioners who are eagerly interested to learn from sir. For that practitioners, we made that workshop courses in Aditya Homeopathic Hospital. So every time we are there, we are there for taking the lectures and sharing the sir's knowledge. So from that part, we are now having the case. With case, I will explain what we are going to learn. Okay. So can I start case?
Yes, definitely, sir. We are waiting for the very insightful session we are going to have.
Yes, and definitely I will make sure that you will, within this 1 hour, everyone will get at least some knowledge about proper case or case taking or pathology or anything from medical side. Yes, thank you.
Yes, sir. And it's my request to all the participants, please do participate in the session. Let's make this learning very interesting today. All you can put your queries even in between the session. You can ask in Q&A session. In Q&A option, you can write your question.
So Dr. Mansi, should I start?
Yes, sir, please start.
So I'm going to share my.
Your video is not visible. Yes, currently now it is visible.
I'm going to share my screen now. Yes. So is it visible now?
Yes. Yes.
So first of all, Mission Homeopathy, as I told, it is a very big organization led by founder of this organization and guided by Dr. Nikam sir, my guru. and all my team members are also there for working togetherly for saving the classical homeopathy. Yes, that is the perfect word for saving, for nurturing the classical homeopathy, because in today's era, homeopathy should be saved, and in that classical homeopathy should be saved, and that is our motto through mission homeopathy. That is motto of sir, which was given to us by sir, that is in the form of mission homeopathy. So we always put our mission as a classical homeopathy to learn, to apply, and to spread. So this is my team. Let us. There are many students who are eagerly waiting for the this type of lectures want to deliver, but few are uh, very fastly raise their hand for these lectures, and their names and photographs are in front of your screen. So all expert homeopaths from different parts of Maharashtra and India. So this is our today's session, and this is a case, and we are going to see six sinus syndrome, a case study of six sinus syndrome. What we are having in this case, what we are going to see in this case, that is what is the exactly case through its physiology, through its anatomy, through its pathophysiology. Everything we are going to see fastly, and then we will start the case. And case is very important. So I will request all uh, positively interested and who are very much eagerly uh, interested in learning the case study. So I have given the name case study because we are learning this case from the pathological point of view. We are learning this case from physiological point of view, and we are learning this case from psychological or mental aspect. So everything is important in our case study, and listen it very keenly for 45 minutes. And I will explain my case. I will show my case, and within these 30 minutes of case taking and case explanation, there are a few important symptoms you will find in this case, and pick up that symptoms on your note paper or your notepad and make the totality. Try to find out the keynote symptoms from this case. Okay, let us start sixth sinus syndrome. What exactly it is? It is also called as I told, sinus node dysfunctioning or sixth sinus syndrome. Definition: it is a group of heart rhythm disorders caused by malfunctioning of heart's natural pacemaker, that is sinoatrial node. SA node, we heard this about in our first year, that is in anatomy. Normal physiology of this SA node is located in right atrium. See here from picture, I'm trying to show this. I've tried to show this. This number one here, there is a location, and this it passes the impulses from atrium to the ventricles. So SA node located in right atrium generates electrical impulses that initiate each heartbeat and maintain a normal heart rate of 60 to 100 beats per minute. Now, pathophysiology of this SA node. When SA node become disease or damage, generation, impulse generation decreases, and that causes sinus bradycardia. When this impulse generation stops temporarily, it is called as sinus arrest. Impulses fail to exit the SA node or sinus node, then it is called as sinoatrial block. Alternating slow and fast rhythms both togetherly, they are called as tachycardia or tachybradycardia syndrome. This leads to, yes, this SA node disease condition or SA node damage. What it leads to? It causes decreased cardiac output and inadequate blood flow to the organs. If there is cardiac output, if cardiac pumping is less, we know it causes less cardiac output and indirectly it causes inadequate blood flow to the organs, especially to the brain. Then, what are the basic causes for this disease SA node, damage SA node, or disease condition of the SA node? There are two types of causes, intrinsic causes and extrinsic causes. What are intrinsic or internal causes? That is age-related fibrosis of SA node, most commonly seen in ischemic heart disease, myocarditis, cardiomyopathies, infiltrative diseases like amyloidosis, sarcoidosis, congenital heart disease. Then, please listen. Causes are very important. Once again, I will emphasizing on this thing because though I am showing you a pathology, though I am showing you the causes of SA node dysfunctioning, they are important in our case also. Normal, common physiology, pathology, and causes, they are giving hint to our case. So extrinsic causes, beta blockers, calcium channel blockers, digoxin, anti-arrhythmic drugs, painkillers, hypothyroidism, electrolyte disturbances like hyperkalemia, and obstructive sleep apnea. So these are some few extrinsic causes. Clinical features of this case or this disease condition. What happens if SA node get defected or damaged or its functions become less? It causes fatigue. It causes fatigue, weakness, dizziness, lightheadedness, syncope, fainting, near syncope syndrome or symptoms, palpitation, dyspnea, exercise intolerance. So these are very important clinical features. What else? It also shows some confusion signs, like especially in the elderly patients. They become confused due to less blood supply to the brain, bradycardia, less than 60 or 50 beats per minute, irregular pulse, hypotension, and syncope episode. Then from clinical side, how we can diagnose this disturbed rhythm of heart, that is through very important investigation method, that is ECG. We know when there is a heart problem is there, we always do the ECG, but in this case, SA node dysfunctioning will be shown by bradycardia. As I told, this is very important. See, fatigue, dizziness, weakness, syncope. These are the important clinical features, but signs, that is, are bradycardia, irregular pulse, and hypotension. These are very important clinical features. And along with that, what happens when there is a bradycardia? There is this P wave, increased spikes. It shows in the form of increased spikes, and there is a large gap between two spikes in bradycardia. And tachybradycardia syndrome, that is, it is somewhat large, and then again gap, very less gap, and then again large gap between the spikes. So that is tachycardia, bradycardia syndrome togetherly alternating. And when there is a bradycardia, there is a huge gap. So these are some ECG findings in the case. So let us go through our case. Now we are coming to our case, patient's case. So it is a known case. When this case came to me, I saw that the patient came to me after discharging, after getting the discharge from the cardiac hospital, and that on discharge paper that was written sick sinus syndrome. Patient is having sick sinus syndrome since 3 days, because he was admitted in that hospital since 3 days. But history is different. That's why I've taken from sick sinus syndrome since 6 days and fracture of navicular bone, foot bone, that is since 6 days. Both are happened 6 days back. So this is the case. What is this case then? In which type this case goes? From duration, it is acute case. Yes, it is acute emergency case, acute emergency, not just acute case, but it is acute emergency case because since last 5 to 6 days he is suffering from. Let us know what happens in the case and what is the exact history in this case of patient. So case history of this patient is a case of 43-year-old male patient brought to me by one of my student, Dr. Srushti, on 13 September 2022 in a very critical condition of bradycardia and low blood pressure. Patient was her uncle who was admitted in ICU in cardiac hospital, cardiac center in Ahilanagar city since 3 days. Then why he was admitted in ICU? What happened exactly with him? So history continues. Patient had an accident due to fall from bike and injury to his foot 6 days back, which causes fracture. He knows it later, but 6 days back there is just injury to the foot, and that was very painful. So he met with the accident and having the injury to the foot. That's why he goes to local doctor at his native place, and that general practitioner prescribe him as usual some painkillers because he is having that swelling and pain at that affected side. So the general practitioner prescribe him some painkillers. What happened when he get that painkillers? After taking that painkillers, patient got vertigo, giddiness, and he get collapse after vomiting. Sudden collapse within few minutes, within 5 to 10 minutes or 15 minutes, you can say. After taking that painkillers, he started that vertigo, giddiness, and get collapse within few minutes. And the family member get scared, so they immediately went to local hospital. That is not the GP practice. That's why they goes to the hospital at that native place, and that doctor found him in bad condition with very low pulse and blood pressure. So that hospital doctor refer him immediately to the other hospital at Nevasapata. That is MD medicine. Refer him to the MD medicine because that was very risky case to put that patient at his hospital. So patient received some medicine in that MD medicine hospital, some medicines with IV line injections for 3 days. He took the treatment there for 3 days, but still his condition was not improved. So he again referred that MD medicine doctor again refer him from that place, his hospital, to another biggest hospital of DM cardiologist in Ahilanagar city. So from that Nevasa Pata, they came to DM cardiologist, cardiac care center. And when he was here, that he was admitted immediately to the ICU and done all the investigations and investigation reports with ECG and 2D echo. In ECG, they find some changes, and 2D echo was normal. Blood investigations are also normal. But after 3 days, he also receiving some inotrops like life-saving drugs. He was on injection NORAD constantly there, but still his BP and pulse was not stable. Not stable, or when they are trying to decrease that NORAD injection course or supplement, then again their pulse will dropping up and BP is coming down. So that DM cardiologist monitored that patient for 3 days, and after 3 days, he suggested him that there is pulse rate and blood pressure is not going to rise up. That's why he suggests him for artificial pacemaker implantation. So this is the case. So after that, pacemaker, when that doctor say them now it is the need to have the artificial pacemaker to this patient. There is no other way to treat him or to save him. That's why the patient gets scared and family members also get scared. Meanwhile, that as I told in the history, uh, Srishti was my student at that time. She asked me about this case, and this is the discharge summary. You can read here that Dama discharge. Dama means what? Discharge again, medical advice. That Srishti asked me what to do, sir. Now that doctor cardiologist is constantly insisting us for the pacemaker, and there is no other way. He's saying that pulse rate and BP is constantly dropping down, and we are get confused. So I said, uh, let brought him to this hospital to me. I will see, because after seeing that 2D echo is normal, some reports I will show you that these reports are normal, and blood reports are also normal. Then I get some confidence that other reports are normal, 2D echo is also normal, EF is also normal. Then why not take the chance to treat this case with homeopathy? So I said, Srishti, bring him to me. And when they came to me, I started immediately to taking the case. And this is a case taking part, that is complaints, chief complaints, you can say, are complaints of. First complaint seen in this case, that is, he is suffering from weakness, giddiness. Since now our proper case taking part started, that is known case. After known case, that is chief complaints, complaints of the patient, what he is suffering from. So every chief complaint should be noted down. That is, he is suffering from weakness, giddiness. Now this is acute emergency case. In this case, you have to take the fast case. You have to look, look after the symptoms. Your observation skill should be prompt, and fast case taking should be there. So I have done I myself taken the case with, when I see him that in bad condition, he's anxious face, and he's constantly asking, "Sir, please give me some medicine so that I can survive, or please make my BP and pulse at regular uh, state," because he was medical person. He's a BSc DMT person, naturopathy is in practice. That's why he gets scared of that heart disease condition. And I can see the anxiousness of this disease and symptoms on his face. That's why he's become very much weak and giddiness, and there is always fainting attacks because of low blood pressure and pulse rate. Aggravation of these complaints are by sitting up. That's why he's constantly want to lie down. In that lying down condition, in my hospital on the bed, I have taken the case with low BP, that is 80 by 50, and pulse rate was 35 to 40 minutes. And when I palpate his pulse, that is very important. So your signs, symptoms, observation, correct interpretation is very important. So here I got that whatever I have seen in this case, that I have written here. So pulse is abnormal, pulse is imperceptible, pulse is weak, and near about 35 to 40 per minute without any NORAD injection free. And he's having chest pain on and off, not very serious chest pain, but mild chest pain is there. Then another complaints is 2 to 3 hours before he developed, that is fever. Mild fever is there with headache, and with the uh, headache located in the temples, not forehead, but he's having that pain in temples with pain in body ache is there. But what he said, with this fever, there is sudden perspiration and sudden decrease perspiration, suddenly spikes of perspiration on his body. So I found that fever symptoms, malaise, headache with weakness. So first two symptoms are important in this case. So present symptoms. weakness, giddiness due to low blood pressure, and pulse is, as I told, that is very weak and irregular and imperceptible slow pulse. Then third complaints, he told me that I have one important symptom is 25 years, pain in my right lower limb with sudden jerk in the limbs, cramps in the right lower muscles, right lower limb muscles, weakness and numbness in right lower limb, since operation, that is paralytic weakness in right lower limb since operation. So he had done operation 20 to 25 years back on his spine, and after that he's suffering from that weakness in his right lower limb with sudden jerks that used to jerks, these cramps and weakness and numbness in his right lower limb, and that is also not having modalities, but suddenly एनी टाइम कभी भी उसको वो सिम्टम पैर में दिखते थे, सडन वीकनेस था. सो पास हिस्ट्री, in this case I got that past history of injury to the right foot 6 days back with fracture of the right navicular bone. Now this is very important, past history of hypovolemic shock after taking allopathic medications or medicines in June 2019. See, he told me, sir, I have same type of symptoms in 2019. Again, at that time, same symptoms and same box was there. That is after medicines or after medications in June 9, 2019. Third past history, that is TB spine or port spine, you can say, at the vertebra L3, L4, L5, S1 in 2003. He was suffering from TB spine, port spine, but wrong operation on that spine in 2003. As I told before, that wrong operation causes, he constantly saying that I have done very big mistakes in my life. I have done that operation, and since that period, I'm always having this lower limb paralysis or right lower limb, having not much strength in my muscles and in limb, and it is always jerky movements, sudden movements are there, cramps are there, numbness is there. So that was the past history. TB spine, then COVID positive 1 year back. This is a case of 2022, and 2 COVID vaccines were taken. Physical generals after past history. Physical generals, habit of alcohol occasionally. See, this is the proper case taking pro forma. We are always following this pro forma in any case, though it is acute or chronic. But in acute also, I have taken some fast symptoms. His appetite was good. Since 3 days, that was decreased, but previously it was good. Not anorexia exactly, but his concerning with the heart symptoms or weakness and manage. Desire for non-veg, spicy chicken, curd, and aversion for the sour food. Basically, not aversion, but he say, I have aversion because this sour food puts me disturbance in my GIT and respiratory. That's why I have taken this food aggravation, sour food aggravation, and thirsty patient. Not much, but thirsty patient. Tongue is clean, bowel, constipation with the hard stool, alternating with the soft stool. He's saying that not always constipated, but alternating with the sometimes पेट साफ होता है नहीं होता है कभी ऐसा, that is constipation with hard stool sometimes or alternating with the soft stool. Then another physical general in the form of that urine. His urine, urination is always having burning many times, or he's having, he told me that burning pain occasionally, but I have given importance to this burning in my case. Perspiration, sudden appears and sudden disappears. Sleep, less since 2 to 3 days. Yes, as I told, appetite is good, but sleep is get disturbed because he's not having that fresh sleep, or he's always scared and anxious and sleepless. So normal sleep was 10:30 to 6:30 a.m. In in every case, we are taking in sleep detail, that is in which position he's having good sleep, or most probably which position he sleeps, and taking whether he was taking the pillow. But in this case, since 3 days he was in ICU, uh, that was not required because lying down better position था उसके लिए. Dreams nil, position lying on back, as I told before, pillow one, covering not required in summer, and thermally he was chilly. See, coverings not required in summer, only that from single point I have concluded him that chilly. It is not like that, because there is intolerance of winter season, and he's not wearing the sweaters, and aversion for the fan and covering the body in winter, and want hot water bath. That's why he's chilly. In short, I have taken here, and like that, mentals also. I talk with him, and I have which symptoms I have seen in this case that we mentioned here. That is his education, BSc DMLT naturopathy. He was very irritable, angry person. He told me us directly, "How is your nature? आपका स्वभाव कैसा है? गुस्सा बहुत जल्दी आता है, यानी चिड़चिड़ा स्वभाव है, और मैं हर वक्त गुस्सा करते रहता हूँ." मैंने क्यों? Because I'm suffering from this disease condition since many years, and in this condition, I have to work for my family, because I'm very much attached with my family, and that was my responsibility. That's why I'm always struggling in my life for food and for financial crisis since 2016, since that operation. So many troubles are there in my life. He's telling me anxiety about money, financial status or financial condition was poor, anxiety family since 2019, and now there is anxiety more about the heart disease or his health. Uh, that's why. Um, but he was hardworking and struggling person, and due to double duty, he become more irritable, and that anger and irritability get increased due to this double duty. So this is about our today's total case. Getting. Uh, so what are your totality? What is your totality? Let us share your totality. अभी totality. Yes, Doctor मानसी मैडम, कैसे देखिए कोई टोटलिटी शेयर कर रहा है तो. Yes, Dr. Rahul.
Hello.
हाँ Dr. Rahul. Yes.
Yes, it's a really interesting case, and you can see that cardiac pathology, how Dr. Sai has been tackling this kind of pathology, which many of us even can't think of. So I think this is the best time or best opportunity for everyone to learn from this case. Everyone, please put your efforts, place your totality in the chat box.
See, we have very less time. That's why within
Yes.
2 minutes we will see if anyone is interested, or those who are interested, they will make their totality and put in the chat box, and then I
Yes.
will share my totality. Okay.
Yes. Yes. That's absolutely right approach. Everyone, please be active.
Please select that symptoms which are very important in this case. You feel that these are very characteristics, and
Yes.
at very first time when I started
Yes.
this,
Anxiety about health has come from this very right. Yes,
yes,
everyone, please
yes,
be active. This is a workshop kind of experience. You can participate. These cases are not just to listen. You can imagine the time and efforts that are put by Dr. Sai. The case has come directly from hospital. This is what we learn at Dr. Nikam sir's hospital. and Dr. Sai is also running his own hospital setup. So please put your efforts. Yes, Dr. Preeti Pawar. Chat box is disabled. It is, you should write it in question and answer. Yes, that is a confusion for many.
Yes, sir. So we have few answers like
Yes, Dr.
Dr.
Mansi, please go ahead.
Yes, like Dr. Preeti Pawar is saying totality, weakness, giddiness,
Yes.
aggravated by sitting, better by lying down.
Yes. Very nice. Very nice. Good observation. Good pickup.
Aggravated on salt.
Yes.
Bhairavi is saying pulse irregular, imperceptible, ailments from operation, weakness alternate with perspiration, ailments from drug abuse, anxious. FATs, sudden shock. Next, we have Dr. Pradnya, chili patient, ill effects of allopathic medicine, thirsty, burning urination, irritable angry patient, ancient money matters, about head pain, temple, perspiration all over body, sore, aggravation, weakness sitting on aggravate, lying ameliorate.
Yes. Yes. Good. Good. Many doctors and students are writing the only single symptom, that is sudden perspiration, but try to make the totality, that few symptoms should be there in totality, like that. Dr. Seema Pillai. Again, there are very much nice response from the participants that they are giving the response. So let us see what are the symptoms I have taken in the totality. But now from this part, the learning starts. Huh? Listen it carefully. See totality. Though this case seems to be very short, or though this case seems very risky, very challenging, you can say, because that from DM cardiologist from ICU, this case came to me with discharge against medical advice, because they don't want to continue with that pacemaker implantation. And when there is no any injection to that patient, his pulse and BP is going to decrease. When he came to me, there was a pulse about 35 to 40 per minute, and that was risky for me also. But still, I have taken the case, and I'm quite sure that homeopathic medicine will work here. But I have to give perfect medicine. So I studied on this case with symptoms. What we have after any case, any type of case, whether it is acute, subacute, chronic, serious, challenging, any case, you are having just the symptoms. But these just symptoms are not just symptoms. You have to classify these symptoms in different categories, like pathological symptoms, or you can say particular symptoms, then physical general symptoms and mental general symptoms. But for any challenging pathological irreversible case, what is important? Pathology. Nikam sir is always teaching us, telling us that whenever there is such a cases, then you have to look after for the pathological symptoms. So pathological symptoms are important. So what are the pathological symptoms in this case? Now just type what are the pathological symptoms you feel in this case. Just pathological symptoms, whether they are common or uncommon, or you, yes, in totality we are always trying to get the characteristic pathological symptoms. Is it? So characteristic symptoms should be there. And in this case, which symptoms are characteristic symptoms? Anyone? Anybody say that? कोई बोलेगा अरे ये केस तो बहुत कॉमन सिम्टम दिखा रही है। जैसे इसमें क्या है, पैथोलॉजिकली इरिवर्सिबल केस है, और पैथोलॉजी के जो सिम्टम दिख रहे हैं, यानी he is having that SA node syndrome and less pulse, less BP, and that's why there is a weakness. So these are common symptoms. But when you are taking these symptoms as a pathological symptom, then you are getting some important hints. As I told in this case, that pulse is important for me. This pulse I have seen in this case, pulse is important for me. That is very abnormal and small, weak pulse and imperceptible pulse. So I pick up these symptoms as it is. Whatever I've seen with my eyes, whatever I felt with my fingers, that is science. Pulse small, pulse weak, pulse imperceptible, abnormal pulse. बीच में पल्स लगता है, बीच में नहीं लगता है, वीक है, कभी एकदम बढ़ जाता है, कभी कम हो जाता है, फुल बाउंड पल्स है, कभी एकदम वीक पल्स है, यानी अबनॉर्मल पल्स है। मोस्ट ऑफ द टाइम वो बहुत वीक है या परसेप्टिबल ही नहीं, इम्परसेप्टिबल। दैट्स व्हाई आई पिक अप दिस सिम्टम्स। एंड हाइपोटेंशन इज देयर। इज इट बीपी इतना लो है तो हाइपोटेंशन ले सकते हैं। सो आई हैव टेकन दिस सिम्टम्स एज अ पैथोलॉजिकल। पल्स एंड हाइपोटेंशन very important symptom. But why there is decreased pulse and decreased blood pressure? Not single time he's suffering from, 2 times. Now, since 6 days, he's suffering from this due to painkillers. And before, in past, there is again in 2019, he was having that hypovolemic shock. That's why it is very important. As a element, element in this case is allopathic medications. See, I have taken this as an element, painkillers, but repertorization is different. Huh? Just I am showing you totality. See, chest pain, ठीक है, ये नहीं लिया तो भी चलेगा, माइल्ड था। पेन एंड क्रैम्प्स इन मसल्स ऑफ द लोअर लिम्ब, सडन जर्क, सडन परस्पिरेशन ऑन एंड ऑफ, स्लीपलेसनेस, बर्निंग मिचुरेशन, ये भी इतना ठीक है लिया, लेकिन बर्निंग मिचुरेशन, फूड डिजायर स्पाइसी, बट फूड एग्रीवेशन, सावर फूड एग्रीवेशन, and patients mental symptoms, irritable and angry nature, anxiety about heart, anxiety health, anxiety financial condition, anxiety family. So this is the perfect combination of what? And thermally chilly. Don't miss that thermal condition unless and until thermals have taken case was not completed. Huh? Thermals are important. Sir is always saying give the remedy according to the thermal state, because thermal state is very important physical general of our body, which is under the functioning of, that is hypothalamus. Hypothalamus controls our whole body, and that is thermoregulatory system was located in the hypothalamus. That's why thermals are very important. If patient is chilly, chilly remedy. Patient hot, hot remedy. Ambithermal remedy. So patient is thermally chilly. I have taken these symptoms. Now, what is the remedy? But before going to remedy, why that remedy not? What are the symptoms you pick up for the repertorization? अभी ऐसे क्या, कौन सा सवाल है कि टोटलिटी ऑफ द सिम्टम क्यों लिया है? फिर ये सब सिम्टम रेपेटराइजेशन में डालेंगे, तो रेपेटरी में डालने के बाद क्या रेमेडी आती है, कौन बताएंगे? यस, रेमेडी की तरफ जाने के पहले ना हम क्या देखते हैं, पहला रिस्पॉन्स देखते हैं। आफ्टर कंप्लीटिंग, लिसन इट carefully, after completing the repertorization, I immediately started the indicated medicine in 30 potency and we started doses at 30-minute इंटरवल। जो 30 पोटेंसी का एक सिंगल डोज था, वो मैंने एक डोज दिया, लेकिन वहां पे रुका नहीं। Why? Because this is acute emergency. After 30 minutes, after half hour, again I repeat that dose, because in this case we are not having NORAD injection. Here we are having our own medicine, homeopathic medicine, है ना? So we can't wait. After one dose, I monitor that BP and pulse. Again, after one dose, again I repeatedly monitoring. So this happens for 5 to 6 times, and after that I see that after 4-5 doses his pulse rate and blood pressure slowly going on improving. There is a slight rise in the BP and pulse, that is 45 to 50 beats per minute, and blood pressure was recorded as a 90 by 60 mm of Hg. Though it was abnormal, but I feel better that medicine is working. But real challenge is after that. Within 5 to 6 hours, pulse rate stabilized at 60 beats per minute, and blood pressure improved at 100 by 70. As both the pulse rate and blood pressure continue to show gradual improvement after the administration of the medicine, I anticipated further stabilization with the same treatment. That's why I continued that treatment and that medicine. But I put him on placebo afterwards. However, considering the cardiac condition, see, this is it reliable for me, or is it correct thing for me that if I put that patient in my hospital without any emergency kit, that is very dangerous. That's why, and after at that evening, I decided, when he was stable, I decided to shift him. So, however, considering the cardiac condition and the need for the specialized evaluation and monitoring, the patient was subsequently referred and shifted to a higher cardiac center, but not that same cardiac center. This time I referred him for another cardiac center for the further management. And what happened? What happened after receiving that dose? After 1 year, when he came to me, I recorded that case. मैंने बोला आपको वीडियो रिकॉर्डिंग आपका करना था, आप केस के बारे में बता सकते हैं क्या? बोले मैं बताऊंगा. इट इज देयर इज नो प्रॉब्लम फॉर मी इफ एनी person is learning from my case. So I am showing this case video. Is it audible, Dr. Rao?
No, sir, not now.
Not audible?
No, sir. If you are using Bluetooth mics, that could be the reason.
No, while sharing, I have to. Just a minute. Huh? बोला नाव.
मी आबासाहेब लालझरी.
Yes, sir.
Is it listening?
Audible.
Yes.
नेवासा तालुका, गेवराई तालुका नेवासा.
So I pause here. Patient language is Marathi. So I hope everyone will try to get his language. Then I will explain what he actually I have written there in his response. Try to get what he's saying. Very few minutes of video.
बोला काय त्रास झाला तुम्हाला 22 मध्ये?
2022 मध्ये बाईकवरून थोडासा ऍक्सिडेंट झाला होता. पायाला लागलं होतं, पायाला सूज आली होती, त्याच्यामध्ये क्रॅम्प आला होता. तर तिथं लोकल डॉक्टरने त्यासाठी पेन किलर दिलं होतं. पेन किलर घेतल्यानंतर चक्कर आली, व्हॉमिटिंग झालं आणि मी लगेच त्याच्यानंतर पडलो काय, म्हणजे चक्कर येऊन कॉलॅप्स झालो काय. कॉलॅप्स झाल्यानंतर पुन्हा हॉस्पिटलमध्ये घेऊन गेले. त्यावेळेस पल्स कमी आहे म्हणून सांगितलं. BP लागत नव्हता, 50च BP लागत होता फक्त. आणि मग त्यांनी आमच्या नेवासा फाट्यावरती MD मेडिसिनकडं शिफ्टिंगसाठी पाठवलं. तिथं पण 3 दिवस ठेवलं. त्यांची इंजेक्शन ट्रीटमेंट वगैरे दिली, पण त्यामध्ये पण पल्स रेट काय म्हणावं तसं वाढला नाही. मग त्यांनी नगरला पाठक डॉक्टरांकडे पाठवलं. पाठव डॉक्टरनी 2D इको वगैरे केल्यानंतर त्यांनी सांगितलं की पल्स रेट काय वाढत नाही. पल्स रेट वाढत नाहीये. मग म्हणजे कमी जास्त होतं, असं फ्लक्च्युएशनमध्ये राहतं. तर त्यामध्ये स्पेस मेकर बसवावं लागेल.
BP किती वाढला त्यांच्या औषधाने, गोळ्यांनी, इंजेक्शनने?
BP तसं असं कन्सिस्टन्सीच नव्हती BPची.
कमीच होतं.
फक्त म्हणजे मॉनिटर पुरतं दिसायचं तो BP वगैरे. त्यांनी नोराड वगैरे बरेच काही इंजेक्शन लावली त्यांनी, पण मग BPची अशी काही कन्सिस्टन्सी नव्हती.
आणि पल्सही वाढत नव्हता.
पल्स पण वाढत नव्हता. त्यांनी साधारणतः 48 ते 72 तास अंडर ऑब्झर्वेशन ठेवलं तिथं ICU मध्ये. 2D इको केला आणि 2D इको केल्यानंतर त्यांनी सांगितलं की पल्स काय वाढत नाहीये, त्यासाठी आपल्याला स्पेस मेकरच बसवावं लागेल. तर म्हटलं स्पेस मेकर, लगेच स्पेस मेकर बसवणं, काही अगोदरची हिस्ट्री नाही, हार्टची वगैरे तसं काही हिस्ट्री नव्हती. सेकंड ओपिनियन म्हणून म्हणजे डॉक्टरांच्या माध्यमातून, आमच्या पत्नीच्या माध्यमातून, सृष्टीला जरी आमची पत्नी डॉक्टर, त्यांच्या माध्यमातून डॉक्टर चिंता याकडं म्हणजे या हॉस्पिटलला आलो. तर त्यांनी खात्रीशीर सांगितलं की याच्यामध्ये पल्स वाढू शकतो, होमिओपॅथीमधून पल्स वाढू शकतो. आणि हाय रिस्कमध्ये त्यांनी पेशंट घेऊन पण पल्स रेट त्यावेळेस कॉन्स्टंट राहिला. आणि अंडर ऑब्झर्वेशनसाठी त्यांनी मग हार्टबीट हॉस्पिटलला ते औषधं
तेव्हा किती होतं पल्स?
तर आल्यानंतर पल्स 35-40 असंच राहायचं पल्स. त्याच्यापेक्षा जास्त वाढत नव्हतं. जास्तीत जास्त 40-42 पर्यंत जायचं पल्स. आणि उठून बसल्यानंतर चक्कर वगैरे यायची लगेच, म्हणजे गरगरायचं तसं. छातीमध्ये पण पेन व्हायचं, पायाची सुस्त होतीच, पाय सुस्त. आणि मला ते बाकीच्या औषधाची, मेडिसिनची ॲलर्जी होती, त्याच्यामुळे ते औषधं घेतली की औषधं घेतली की BP आणखी लो व्हायचं. इंजेक्शन गोळ्या वगैरे घेतल्या, त्याच्यामुळे निर्णय घेतला की होमिओपॅथीचीच औषधं घ्यायची. आणि त्यानंतर मग BP आणि पल्स
किती दिवसात वाढला पण तो?
साधारण त्यानंतर आल्यानंतर बाहेरून, म्हणजे त्यांची इंजेक्शन वगैरे बंद केल्यानंतर, इथं हॉस्पिटलला आल्यानंतर एक 5 ते 6 तासात बऱ्यापैकी पल्स वाढायला सुरुवात केली. पण सरांचं म्हणजे तुमचं म्हणणं असं होतं की अंडर ऑब्झर्वेशन ठेवलं पाहिजे, म्हणून आम्ही कदम सरांकडे हार्टबीटला शिफ्ट झालो. तिथं पण त्यांनी 48 ते 72 तास ठेवलं. पण त्यांनी सांगितलं की ही औषधं कंटिन्यू ठेवा, कारण हे इफेक्टिव्ह आहेत आणि याच्यामधून पल्स रेट वाढतोय तुमचा. तिथं गेल्यानंतर 3 दिवस त्यांनी ठेवलं. मग त्यांच्या लक्षात आलं की आता पल्समध्ये बऱ्या प्रमाणात सुधारणा आहे. मग त्यांनी डिस्चार्ज दिला. त्यानंतर होमिओपॅथीचीच औषधं कंटिन्यू केली 6 ते 8 महिने. म्हणजे अद्याप
परत काही
त्रास नाही झाला.
परत तशी रिॲक्शन पण नाही आली.
रिॲक्शन नाही आली त्याच्यावरती. आणि स्पेस मेकर बसवायची काही गरज पडली नाही. अद्याप तरी त्रास नाही त्याचा काही अजून.
कमरेच्या पायाच्या त्रासासाठी पण आपण औषध चालू केलं, त्याला किती रिझल्ट आहे?
कमरेच्या, आणि कारण खूप 20-25 वर्षापूर्वी माझं सर्जरी झालं होतं मणक्याचं, आणि त्यामधून भरपूर साऱ्या ट्रीटमेंट केल्या. पण न्यूरोलॉजिकल इफेक्ट असल्यामुळे ते काही समाधानकारक त्याच्या रिझल्ट नव्हती. त्यानंतर मग होमिओपॅथीची पण औषधं चालू केली. तर त्यामध्ये पण चांगल्यापैकी फरक पडला. म्हणजे सुरुवातीला 20% 30%
काय त्रास व्हायचा तुम्हाला?
So this is the case, and patient's response in his word. Patient say, after receiving that dose, within 5 to 6 hours, my pulse rate going to start improving, and blood pressure, which was fluctuating, that is also stable. And still, I refer him to other hospital for cardiac care, for under observation, and in that other cardiac care center, he was on homeopathic medicine only. And after 3 days, or after 2 days, he was discharged from there, and he continued with homeopathic medicine until now. He is only on homeopathic medicine, and he's on that medicine. There is no any complaints with his heart. And what he said, that my back pain, my limb paralysis, weakness, that pain, jerks also decrease. 35 to 40% result is there. So this is the case. So guess the remedy fast. What is remedy? Chat box, Dr. Rao. Yes, I will see in question answer. क्या है मेडिसिन? Allopathic hypersensitivity, anxious about health. Yes, very nice. Retrum album, gelsemium.
So Bhartini is saying Ignatia 30, Jane is saying
Aconite.
Digitalis.
Causticum. Gelsemium, Naxomica, digitalis.
Yes.
Fast responses are there. Kalicar. So after repetization, सभी ने repetization किया होगा. अभी देखते हैं क्या remedy आई है and क्यों आई. So remedy, why that remedy is very important. With very fast, within 5 minutes, I will complete my case. So remedy is, everyone is eagerly waiting for the doses. I have remedy name and doses. So I continue that medicine for 3 times in a day for 2 days more. When he's discharged from that hospital also, and in that hospital also for 3 days, I repeated that dose in 30 potency, and that was the medicine. Aconite Nepalese. So this is the aconite case, very simple case, very easy case. And why aconite? Now, why aconite is very important. Yes, aconite, because as I told, now pathological symptoms are very important in this case. What pathological symptoms I have very firstly markedly seen in this case, that I have chosen for the repetization, that is hypotension first, then low pulse or imperceptible pulse. Weak pulse or imperceptible or abnormal pulse. If you are taking just imperceptible and abnormal pulse with hypotension, there is aconite. Then along with that weak pulse, there is aconite. But I never stop here. I confirm my medicine with which symptom? Very important, that elements from allopathic medications. But एलोपैथिक ओवरडोज है कि यहाँ पे एलोपैथिक मेडिसिन का बहुत ओवरडोज हुआ और उसके वजह से पेशेंट कोलैप्स हुआ? नहीं. He is, what is the symptom? He is oversensitive to drugs, oversensitive to medication. So in synthetic repertory, that is under physical journals, there is medicaments. In that medicaments, patient is oversensitive to allopathic drugs. And in that oversensitiveness, there are very few drugs like aconite, 1 mark, pulsatilla, phosphoric acid, naxomica, sulfur. So though there is 1 mark to aconite, but that is very important. And this is a clue for me that yes, aconite is the perfect medicine in these skills. Why? Because food aggravation, sour food aggravation, 3 marks. Temple pain in temples, yes, another particular or keynote symptoms. Again, they are covered by aconite. That is heart complaints, local complaints, headache, food aggravation, physical generals. Then mental generals. Mental generals are, what are the mental symptoms here? That is anxiousness, anxiety about the health, anxiety about the heart disease, anxiety for the family. So very easy case. But when it is become easy, when you try to solve it with your perspective, perfect rubric selection should be there. See, as I told before that totality में हमने जो देखा था, totality में क्या था, बहुत symptoms थे, लेकिन उसमें से भी फिर pathological symptom जो important है वो लिए repeatization में, फिर physical generals लिए and mental generals लिए. So this is the perfect combination and balanced state for the repeatization, and I got that aconite. What is the another close remedy here? Phosphorus is close remedy. Because he is suffering from that pot spine, that is tuberculosis of the spine, and his constitution is also like a phosphorus. He is oversensitive to drugs, but oversensitiveness to drug, their phosphorus is not covered. Phosphorus patients are oversensitive, but not for the drugs. Phosphorus covers almost 9 symptoms. Nux vomica also covers almost 9 symptoms, but phosphorus is not having the in listed that oversensitive to allopathic medication. That's why phosphorus is not the. But another reason for aconite and why not nux and phosphorus is very important cause about the aconite is, see this, Clark mentioned that pearls at first on entering in the one room more frequent and then sinks far normal, small, imperceptible, weak sound of the heart at the heartbeat, heard at the apex, and mind, anguish, fear, death, intellect, perfect, fear of ideas, sluggish, long reflection, impossible, power of attention impaired, feels like one sleeping and dreaming, forgetfulness, trembling of the limbs, vertigo, and confusion with ringing in the ears, falls almost immediately with giddiness, dimness of the vision, and muscular weakness. Getting it? That is about the head. Because less blood supply to the head, sudden collapse. Malaise, also there is muscular weakness, that is out of generalities. So this is about the aconite, very important case. What is the differentiation? Aconite, phosphorus, and nux heart symptoms are there. Feel slow, and in aconite, these are the symptoms from fatigues. Feels swelled, carditis, palpitation with anxiety, fainting and tingling in the fingers, pain down the left arm, heart pain into the left shoulder, and sitting erect, tachycardia, pulse fast, bounding, shaking, forcible, and tremulous, wiry pulse, very irritable, and arterial tension is there. But these symptoms not seen in phosphorus. Pulse is rapid, small, soft, and in nux there is palpitation on lying down, heart feels tired, angina pectoris, pain in right arm in phosphorus, violent palpitation with anxiety from the least things during goiter. So that is the biggest differentiation of aconite, phosphorus, and nux vomica. So this is an interesting case on my part about the heart condition, and which was treated by, very beautifully treated by, very day-to-day practice medicine. All listeners, please listen carefully. Read aconite from the Clark. You will get lot much idea about the Clark, about the aconite from the Clark, because though we are thinking aconite is a very small drug, acute drug, that is for fever, but not like that. Aconite is a very important drug in chronic condition also. I have treated with aconite one myocardial infarction, old age patient, aconite. So when symptom, Clark say, Hahnemann says, when symptom matches, aconite is the best remedy. Best remedy. So always have the knowledge about the mud remedy ka. Very important. Thank you very much. Thank you, Dr. Let's see. Yes, that is on my part.
Thank you so much, sir, for lots of efforts you have put it in this session. And the session was really very informative. Now it's time for the question and answer session. Any doubts? Any questions from the audience? So, sir, everyone is thanking you for this brilliant session.
There are good responses from the participants.
Yes. And
Uh,
we have one question. So, please tell us about potency. Why not 200?
Why not 200? Nice question.
Yes.
Yes. See, why not 200? Because 30 is the not lower potency, 30 is not higher potency. Above 30, every potency going to rise up, or you are going to the higher side. And whenever you are going for the higher potency, there are chances of aggravation of the symptoms. This is the knowledge given by the Nikhil sir. Why 30? Why 30? 30 is the middle potency, and all drugs are proved in 30 potency, and symptoms are very beautifully treated by 30 potency. Proving is in 30 potency, and 30 potency will beautifully manage. There is no aggravation at all. If by chance not wrong, but when you are right also, no any medicinal aggravation is there, and no any pathological aggravation is there. Suppose in this case, it is very serious case, it is very challenging case, and you should select perfect simulum. Along with that, perfect potency should be there. And since 2003, I am working with sir, and practicing since 2003. But only one potency, that is 30 potency, and having excellent result with 30 potency without any aggravation. See, this is a very irreversible pathological case, and Dr. Haniman saying in any pathological worst case, you have to select 30 potency. If you are going for higher 1M potency or 200, 1M, 10M, there may be chances of aggravation. It is very much risky. Always listen everyone that in pathological cases, go for the 30 potency. It is very safer for the patient also, and for our practice also. Okay?
All right, sir. Thank you so much for this beautiful answer.
What are the responses?
The responses are very good.
Feedback? Yes.
So definitely. People are saying interesting case. Thank you.
One asking for
Great
that why
session.
sudden weakness and sudden perspiration was not considered for the repetization.
Yes, yes. And we have one more. Did you continue Aconite or afterward changed remedy according to whole history?
Yes, very nice question. Who asked that question?
Sir Monica Totani.
Yes. Okay. What was my second remedy in this case in the repetization sheet? Phosphorus.
Phosphorus. Okay.
What is phosphorus then? Phosphorus is a slow acting remedy. Aconite is a very fast acting remedy. Pace of remedy is very important. Rapidity, acute state condition, and emergency state, and symptoms are matching. That's why Aconite at that time for few months. After few months, that patient say, काही महीन्यानंतर कुछ दिनों के बाद फिर से मैंने मेरे पैरों के लिए भी मेडिसिन लिया और वो भी ठीक होने लगा. But at that time, I prescribed him single dose of phosphorus. Only one phosphorus 30, and his that complicated case, worse case, or you can say that wrong operation on his spine, and due to that he's having that numbness, paralytic weakness, jerks, that decreases up to 50%, and he easily can walk on his legs with that phosphorus 30 single dose. Now ask why not in that
200.
cardiac condition. And why not first remedy? Phosphorus, why not first remedy? Because need of the case, need of the pace. अभी यहाँ पे इतने सडनली उसका बीपी ड्रॉप हुआ है, सडनली उसका पल्स ड्रॉप हुआ है, सडनली सिंकोप कंडीशन में गया, और ऑल पैथोलॉजी कहाँ क्या मैच कर रही है, एक्रोनाइट को मैच कर रही है ना, ये इतना
Aconite is acute remedy.
acute remedy. Rapidity is there, violence is there. Acute rapid violent symptoms can be seen like a storm in aconite, and other symptoms are also matching with the aconite for that moment. And heart remedy है, phosphorus heart remedy है, लेकिन उसका pace slow है ना. Phosphorus is more degenerative remedy, aconite is more syphilitic remedy, acute emergency remedy. It is though you are saying acute remedy for sura, but it is also in syphilitic condition can be prescribed in these cases, like and to survive. So एकोनाइट मैंने कंटिन्यू किया कुछ महीनों के लिए, लेकिन बाद में उसको फिर इस पे रखा फॉस्फोरस सिंगल डोज, और बीच बीच में डोज देते रहा. अभी भी वो पेशेंट आते हैं और थैंक्स बोलकर चले जाते हैं, क्योंकि ही इज वेरी नाइस ना. So homeopathy gives him a double life with double energy, and saves his money, lot many lakhs. Otherwise, he should walk with the pacemaker in the heart. You know? So this is the beauty of homeopathy. Thank you.
Okay, so we are covering the last question as we have covered lots of questions. So one is asking, please explain the miasms related to the case.
अभी बोला ना मैंने, माइजम क्या है, एक्यूट इमरजेंसी है लेकिन सिफिलिटिक की तरफ जा रहा है ना. अभी यहाँ पे फास्ट एक्टिंग रेमेडी नहीं मिला होता है ना. तो फास्ट एक्टिंग रेमेडीज कौन कौन से आते हैं, तो हार्ट रिलेटेड जो आते हैं, जो सब मैच करते हैं, वो मेडिसिन यहाँ पे देना है. दो इट इज एकोनाइट इज एक्यूट, बट इट इज द सिफिलिटिक कंडीशन. यहाँ पे सिफिलिटिक स्टेट है, इसीलिए सिफिलिटिक रेमेडी यू से दैट इज सल्फर, लैक्टेशेस, नाजा, ये सिफिलिटिक रेमेडीज है, मर्क है. लेकिन यहाँ पे इम्पोर्टेंट है कि एकोनाइट के सब सिम्टम मैच हो रहे हैं. एकोनाइट इज अगेन सिफिलिटिक रेमेडी. So prescribes aconite on that need of the symptoms, repetition में जो दिख रहा था. और फिर बाद में degenerative remedy, और you can say tubercular remedy, that is phosphorus single dose. So ये यहाँ पे दो केसेस हुए, एक तो एकोनाइट हुआ है, लेकिन phosphorus क्यों दिया है वो भी वहां पे दिखाया मैंने. See पैरालाइज पार्ट, वहाँ उसमें लास्ट वाला जो सिम्टम था रेपेटर शीट में, that is paralysis, and in the jerk in the paralyzed part that is covered by three उसको मार्क थे, that is phosphorus, और बाकी सब symptoms उसको phosphorus के मैच हो रहे थे, सिर्फ that is not covered. What was that symptom? Elements from medicament abuse or oversensitive to medicaments, उसमें phosphorus नहीं था, इसीलिए phosphorus नहीं दिया. लेकिन बाद में फिर वो paralyzed part का jerk phosphorus cover कर रहा है, इसलिए phosphorus का एक डोज दिया, and he will be okay with that limb problems. Okay.
Okay, sir, thank you so much for this wonderful explanation. And now it's time to wrap up, as we have done with the case. And audience has also put it there very good questions. And after this session will upload on the Homeopathy 360 YouTube channel. You can check out our YouTube channel. I'm going to share by sharing the screen. So here is our YouTube channel of Homeopathy 360, where you will find this video of this session. like our previous channel, our previous video with Dr. Rahul Jadhav. It has been uploaded. Here you can see
Yes.
all the videos and shorts you can find on this session, on this YouTube channel.
Mm.
Now I would like to thank Dr. Sai Chintan sir. Thank you so much, sir, for
Yes.
giving us your valuable time and your efforts.
Thank
We
you
have
very much.
learned so much from this case.
Thank you, Homeopathy 360, for collaborating and for giving us a chance. And thanks, audience, definitely for your patiently listening. And always follow these sessions, webinar, because next Friday there is a topic from Dr. Sheetal Kumar, I think so, no? Dr.
Yes.
Sheetal Kumar Sonone, who was again a sir's best student, and he's practicing in Kopargaon since 15 to 20 years, and he's having a very nice cases. We are always making seminars with him in Ahilyanagar city every year, at least 2 times, and all students are get charged with his organon commanding knowledge, and that's why he's having again a next Friday very good session. So always attend that session. So thank you very much, Dr. Mansi.
Thank you so much, sir. Thank you.
Yes.